In this video, I'm sharing the number one reason why so many people don't feel their backs during a row and the 3 ways that we can fix it. What's up, guys? If you're new here, my name is Dr. Brian Larish, and I'm the owner of a cash-based physical therapy clinic, as well as the owner of the PT Growth Academy. Now, when I have a patient or a client perform a row for the very first time, I always ask them when they're done, where did you feel it? I know it sounds like a crazy question, but so many of us do rows to work our back, but don't actually feel our back. And so when I bring this up to patients and clients, it's usually an aha moment because they never really took a second to think and ask, do I actually feel my back? And so what we then go into is why we don't feel it. And then I go through this 3-part framework that I want to share with you. So let's talk about this big mistake and then the steps to fix it. It's much easier to understand this common mistake if you can stand up and go through this drill with me. What I want you to do is to bring one arm straight out as if you're about to start a row. And then I just want you to go through the rowing position. And I want you to stop when you feel like you've gone through your full range of your row. And then take a picture, take note. Where is your arm and where is your elbow? What often happens is as we go through a row, it looks like this. The problem here, and the overarching number one problem, is excessive humeral extension. Now, if you're not in the movement world, don't worry. All I'm saying is that this arm is moving way too far back. It's going into extension. Why we don't want this is because we're not actually moving or contracting our back. Instead, we end up in this like vulnerable forward shoulder position as we're usually loading the joint with a dumbbell or a barbell. And so it's really easy to see on this guy because he's super stiff, but this is literally what's happening. As you go through a row, we're just getting motion through the shoulder. See how this scapula, the shoulder blade, isn't moving. What should be happening is this should be gliding towards the spine. But a lot of us are so compressed here, and so it's literally just like this. We're only moving the arm, and if I turn towards the camera, we end in this position where the elbow is back, we're stressing our anterior shoulder, and we never feel our back because we actually didn't signal and cue the back because we're not actually moving it. So again, big mistake, excessive humeral extension, aka we move the arm way too far back. And the number one thing we can do to improve this is to increase scapular retraction awareness. Awareness is the key. We need to build awareness and confidence that we're actually moving the scapula. Why? Once the scapula moves, we start to feel our back. Once the scapula moves, we start to not hurt this anterior shoulder. And once the scapula moves, we actually start to build that upper back. Now we understand that the overall goal is to increase scapular retraction. With that being said, I want to go through 3 steps that if you're a PT or a personal trainer, you can use this on your patients or clients. And if you are watching this video and you just want to improve your row, you can go through these as well. Just make sure that you're confident when and where you feel things. So the first step in increasing scapular retraction awareness is pulling our arm out of a sleeve. This is what I want you to do. Go ahead, stand up, bring your arm nice and straight. I want you to imagine that your arm is in a sleeve or a tube that is very rigid and hard, and you cannot bend your elbow. It's completely skin tight. From here, I want you to pull your arm out of the sleeve. How would you do it? You can't bend your elbow. What you're going to need to do is to start to draw back and to start to pull that arm out of the sleeve. That is scapular retraction. This is scapular protraction. And so I want you to get really comfortable and familiar with scapular retraction by pulling our arm out of a skin-tight sleeve and then pushing it back in. Pull it out, go back in. Notice how I'm not doing this aggressively where I'm going into extension and flaring into that pull back, pinch the shoulder blade sensation. It's very smooth and effortless. As I go through it, the right shoulder in this scenario is staying down. This is not pulling the arm out of the sleeve. You're not going to get it out. You've got to go straight back. So step number one, pull the arm out of the sleeve to start to build scapular retraction and protraction awareness. Step number two is combined movements. So you should be confident and familiar with pulling our arm out of the sleeve, but we all know that's not how a row looks, right? We have to actually bend the elbow. And so we need to now combine shoulder blade or scapular retraction with elbow flexion and shoulder extension. Don't worry about all that. Just know that as we pull back, we have to now start to bend the arm, and the overall point that we are looking to end at is in line with our rib cage. There's absolutely no need to go back here, because once we get back here, we're just rolling forward. We're going through that humeral extension that we're trying to avoid. Further back does not mean more back engagement. It actually means less. We're just rolling the arm. So this drill, we are trying to start or initiate with that slight scapular retraction. And as I'm retracting, I'm bending the elbow, and that elbow continues to bend as we continue to bring that shoulder blade back. The shoulder blade never stops retracting. That's what is tricky during this, is that people can usually start retracting, and as they're retracting, once they start to bend their elbow, they stop moving the shoulder blade. Both of these end together. Shoulder blade retracts, bending the elbow, keep retracting the shoulder blade, and once we get to about in line with our ribs, you should feel your back actually contracted. All right? So, increasing scapular protraction awareness. Now we're getting combined motion to more of that familiar row-like technique. Our third and final step is to load it. Now we want to use a band or a dumbbell or a barbell, preferably a band, so that we can start to feel what it should feel like under load. So we're going to go through those same steps. So what we're thinking is we can start to get that scapular retraction. We can then start to bend that elbow, and then what we want to feel is that in this position, once I'm at the end range, I am 100% confident that I feel my shoulder blade or upper back muscles. This is what we're trying to feel during a row. What I like about the band is that as we go through this motion, once we get to that end range and we're here by our side and we're not there, then we can actually take little baby steps out. And those baby steps should actually increase the shoulder blade contraction if you have it. If it doesn't, then we probably don't have that scapular retraction. And what can't happen is as we go, we can't let that arm go forward. We can't let that arm start to go forward in the way that we're trying to avoid. So we have to keep everything exactly where it is. But using a band, going through scapular retraction, elbow position, overall ending position, and then walking back is a great way to start to gain confidence to know that you actually can feel your back. Now, once we understand these three steps, we can start to really load it in our traditional barbells, cables, and dumbbells.